If you suffer with loose dentures or you are embarrassed to smile because you have missing teeth, here's how mini dental implants will change your life.
I have 4 teeth missing in the back.
I couldn't hide it any longer.
The constant adjustments, it seemed like I was back at my dentist every other week to adjust this and adjust that.
I couldn't eat almost anything.
I'm gonna go and get this done.
Because you don't want to go around without teeth.
Getting the mini dental implants was a life changer for me.
It's more affordable.
Very affordable. It's well worth it.
There was no pain.
What pain?
I can eat everything. It's unbelievable.
I don't have to put all the goo on.
With these, I can eat everything.
Now I can smile and show the world.
I don't have to worry about being embarrassed going to a restaurant.
It's the best decision I ever made.
It gave me the confidence to have my smile back.
It hasn't made my life easier, it sure has.
The mini implants are the only way to go.
It's been fantastic.
It was life-changing.
I don't know what else to say except it was almost a miracle.
It's just so much better.
I'm happy. I'm very happy.
It literally changed my life.
My dental implant has changed my life.
I'm excited to be me again.
I feel like me again.
It'll be the best, smartest move you ever made.
I love it.
It's incredible. It is. It's absolutely incredible.
Welcome to Innovations in Health. I'm John DeSciullo. We are talking about mini dental implants. It's a procedure that's going to change your life where you can be you again. And joining us to tell us all about it is Dr. Matt Lasorsa from Central Florida Dentist Group. Dr. Lasorsa, welcome to our program.
Thank you, John. Thank you for having me on.
You're welcome. We're going to learn a little bit more about Dr. Lasorsa in just a little bit, but first, the mini dental implant. It's revolutionary, it's FDA approved, and this is what it's all about. It is 5 times less invasive, less pain and discomfort, less healing time, less visits to the dentist, and less expensive. So if someone has a denture, particularly a lower denture, a lot of people are used to it, so swimming around on the gum. This will stabilize the lower denture, and you'll show us why with a lower example, Dr. Lasorsa.
Absolutely. I don't recommend anybody has a lower denture without some kind of implants to stabilize it. On the upper denture, it tends to be okay because they have suction up there, and some people can deal with an upper denture. But on a lower denture, there's a very thin ridge. A lot of times you have your tongue down there moving around, you have your cheeks moving around when you're chewing. You can't get suction on it, so people depend on the glues. Well, without the glue, we can have mini dental implants, and it has these attachments processed into it, so it makes a snap over your implants, and then it's stabilized.
And that mini dental implant is a titanium post that goes right in, and that's what helps stabilize the denture right there. All right, so that's the lower. Let's take a look at an upper, because now our sense of taste is going to come back.
This is an upper denture. It's very similar. The bone is a little softer on the upper, so we use more implants on the upper. You know, the model shows 6. If there's room, I'll put a few more. And as we go towards the back of the mouth, the bone gets a little softer, so my implants get a little wider. But it works the same way. We have these attachments processed to the inside of it that will snap onto your implants. Hold it very tight. And with that, we don't need a palate anymore. And that's where people complain that they can't taste their food anymore because there's a palate in the way, or they gag because of the palate. And we can eliminate that just by using mini dental implants.
Now take that off again, because I want to see. So there on the upper, it has that curve, and that would not be there normally with a regular upper denture.
No, with a regular upper denture without implants, you need that suction on the palate to hold it in.
So now without this piece of plastic, your sense of taste to bite into the juicy steaks that we love and all the great seafood here in Florida, it all comes back, and the fresh fruits and vegetables that are grown right here in our own backyard, that sense of taste is now back.
Absolutely. Along with the fact that you can eat whatever you want and not worry about glues, not worry about them falling out, not worry about laughing out loud or sneezing. They're not going to come out.
Yeah, I mean, I can't imagine, having a denture. My mom had dentures for a long time, and that was a long time ago, and you just sort of resigned yourself to the fact that that's how it was going to be, but you don't have to have that anymore.
Not anymore.
There's another opportunity to make it as if you have a new set of teeth, and to show us how this works.
This one is coined the fixed on 6, which it's not fixed, and it's usually not on 6. I usually put more implants on there. The more implants we get and the more support we have in the posterior, the thinner we can make the restoration, the thinner we can make the prosthesis.
Less plastic.
Yeah, and we use a different material for this. We use a stronger material. It's not acrylic like a denture. And because we're using a stronger material and we have more support, we can make this very thin. Now this will snap in and out also, but we don't need all that tissue support because we have more titanium or implant support. So this becomes a lot more natural.
It looks terrific, but as God gave us our baby teeth and our adult teeth, Dr. Lasorsa from Central Florida Dentist Group. You're going to give us our third set of teeth. This is called the Roundhouse. This is the ultimate mini dental implant experience.
Okay. The Roundhouse is something that's not removable at all. This is something that is either cemented in some implant systems it's screwed in, but this is as close as we can get to your natural teeth. This will not be removed, and this is made out of a different material also. So it's not an acrylic denture, but it is fixed in place, and once again, this will, like John said, give you your third set of teeth.
And it looks terrific, and this can happen on the upper or the lower. And no matter what your age, we generally think of dentures for folks who are a little older, and that's fine. And you know what, if you're a little older and you're thinking, well, my age, no. You need to enjoy life. In fact, stay tuned, because we're going to share a story of somebody who really found a brand new life at a later age, and it's an amazing story. You want to stay tuned to watch that. So the mini dental implant can be something that anyone of any age can enjoy.
Absolutely.
Now, with that, you have a single tooth. Say you're out fishing. I know you like to fish, Doc.
Every chance I get.
Yep, you're always out.
Yeah.
If you get a tooth that's knocked out from an accident, a sporting injury, or a car accident, or some other health issue, you have an example of a single tooth and a side tooth option.
I do. It's very common with a sports injury, or sometimes a car accident or something, somebody knocks out a front tooth. We can put a mini dental implant in that place as long as we have the bone for it and the health history for it. And very quickly, usually the same day, I can put a temporary crown on it, and once that heals, we can put a permanent crown on it.
And what's interesting about this, Dr. Lasorsa, these are teeth that they don't come in a box and it's something for everybody.
No.
These are custom made for the patient.
These are custom made for the patient, exactly.
And it looks terrific, and it's formed to make sense with the other teeth that it's helping out.
Yeah.
And if you have a side tooth, some people look in the back of their mouth and say, well, I've got some problems and I'm not going to worry about it. Out of sight, out of mind. But those back teeth are very important for so many reasons. Show us an example of that.
An example where some back teeth are missing, maybe a couple of them together, would be this. This is where we put a couple implants in a row, and then we make a fused bridge or a couple of crowns or teeth fused together, and that gets cemented on also, and that will restore your bite in the back. It is very important to have some back teeth, because the back teeth are made for the clenching and the grinding to chew up our food. If we don't have them, we start putting excessive forces on our front teeth, and they wear down very quickly, and they can break just from that. So back teeth are important, even though a lot of people don't see them.
Well, and the other piece of that is, your mouth will get deformed, the face kind of gets sucked in. You see that a lot. That's because those teeth and the mouth really misshape after a while, and you want to get all the nutrition out of the food that you're now going to enjoy again with those back teeth, to chew as many and get as many enzymes and all that nutrition out of it, because the dental health really helps your overall health.
Yeah, it starts there.
Yeah. So let's talk about you for a little bit, Doc. Where did you grow up?
I grew up in Massachusetts. Went to college at UMass Amherst, and then I went to dental school at Tufts University School of Dental Medicine in Boston.
So what brought you here to Florida?
I wanted to fish year round. So Florida seemed like a good place to go. I did a one-year residency at the Veterans Administration in Gainesville, Florida. And while I was doing my residency, I met my wife, Alexa, who was going to University of Florida Dental School, and I decided to stay in Florida.
Not only is she your wife, she's also a part of the practice. How does that work? She's a dentist.
Yeah, she's a dentist. My wife does a lot of the cosmetic things, a lot of the restorative dental work. She does the crowns, the fillings, the dentures, a lot of cosmetic things like Botox or teeth whitening, things like that. And I'm the blood and guts guy. I do the root canals and the surgery. So usually you'll see me for the surgery. We'll get you healed, and then she can finish it off by doing the restorations to make everything look nice and function nice.
And tell us about your other team. You have great long-term people that are at your facilities.
I do. My staff is handpicked. They've all been working with me for a lot of years. They're very knowledgeable. We get along very well, and we work together.
And your family's here?
Well, we have 3 children. We have 2 boys and a girl. Yes, the girl's stuck in the middle of an older and younger brother.
Oh boy.
But she's protected that way, So yeah, I'd spend every minute I can with my family.
Well, no better place to raise a family than here in Florida.
It's great.
It's the Sunshine State in so many ways.
Yeah, it's great.
And you mentioned the veterans. We're going to talk a little bit more about what you've done to help vets, but in your practice, you have the latest technology. I think it's very important to note that you have what's called the cone beam. It sounds like something out of a science fiction movie, but what does the cone beam do?
The cone beam is a 3-dimensional scanner, similar to like when you get an MRI, but this shows a three-dimensional picture of your bones, your sinuses, your nerve structures, the way your jaws come together. It gives me a really clear diagnostic view of what I can do for you. It tells me absolutely how much bone you have and how much we can use.
Yeah, you know, back in the old days, you'd have to have that goop and you'd have the model made out of your teeth and you'd have to wear, now that's all gone. The technology has made it so impressive that you can now look in someone's mouth and define exactly where things are going to go.
Mm-hmm.
It's amazing.
Yeah, it's great.
Yeah, and I know that part of that technology is learned up in Buffalo. You fly all the way up and you get to see a dentist who has revolutionized this technique for the mini dental implant. Tell us about that.
Dr. Todd Shatkin up in Buffalo was really the leader in mini dental implants in the community. They were used before then. They were used in the 70s when they were kind of discovered, but Todd really made it popular and he really took the initiative to not only use them, but train the rest of us and have him and his team available to appropriately use them.
And then as a result, you are now the mini dental implant specialist in Central Florida. So whether you're on the Atlantic coast, the Gulf Coast, Gainesville, Orlando, anywhere, you can connect. And if you want to find out more, the phone number to call is 352-269-8009. The team is there ready to take your call and they'll find out what procedure you need, where to go. Online, it's centralfldentist.com. Online, centralfldentist.com on the web. And that number again, 352-269-8009. So when you meet with patients, it's a free consultation.
Yes,
What do you discuss?
Free consultation. First, we take a CT scan. We take a very thorough medical history. We need to know, what medications they're taking, if there are any, who their doctors are, who their physicians are. And I talk about what the patient really wants. What are they looking for when they come to see me? Because we have so many options. We have, fixed options. We have removable options. And how much time and commitment do they want to come to the office to get to where they want to?
And in that consultation, I'm sure you talk about how much this is going to cost.
We have to, of course. Everybody wants to know how much it's going to cost.
We're so used to paying for our cars monthly or a major appliance or some other piece of our life. You make it affordable. In fact, on your website, you have an opportunity to click and it's called Care Credit. Tell our viewers about that.
Yeah, Care Credit it's a financing company that we use a lot, and it will allow you to have different options of payments, how much per month or how many months, so that it's affordable, so that it's available.
And you make it affordable. I think that's the key word there, Dr.
Yeah,
Lasorsa.
we'll keep going through the different financing options until we get the number you want, so that we can do what you want.
And we should mention the mini dental implant is less expensive than the conventional implants. They're less invasive, less pain and discomfort, less healing time, less visits to the dentist. Not that you don't want to go to see Dr. Matt Lasorsa and his wife and his team at Central Florida Dentist Group, and less expensive. So you make it worthwhile because this is an investment in yourself. Some people put it off. They shouldn't. They should look at this as an opportunity to look better if they're going into a new job or a relationship. Mm-hmm. How does that relate with the patients that you've seen who've decided to get the mini dental implant?
Well, I see that a lot, and because I haven't had a lot of dental work done myself, I kind of take it for granted. But it always amazes me when people say, nobody wanted to talk to me when my teeth weren't pretty. No, everybody kept looking away from me. They feel so much more confident when they look at themselves and when they're out in the public. I have several patients that wouldn't come out of their house or wouldn't go to get a job because they were embarrassed at the way they looked. And it's been life-changing for them that they feel a lot more confident they can do those things now.
So those are very important pieces of information. So if you're out there watching and you're thinking the mini dental implant might be for you, then you need to call Dr. Lasorsa at 352-269-8009. It could change your life. You can be you again. I think that's very important. And the reason I say that is because, you've become a YouTube sensation, Dr. Lasorsa. We were looking online, and you have an incredible amount of testimonials. And I wanted to read one of them before we show some video, because I think it's worth mentioning that this individual, and this is an unsolicited testimonial, all I can say is, wow. This was the only dental visit in my life where I truly felt they wanted to help me more than they wanted my money. And they were able to create a sensible treatment plan within my budget that made me cry tears of joy. If anyone needs this procedure, I would not just recommend it, I would push you to do it ASAP. It will change your life, it changed mine, and that's signed Christopher. And on YouTube, you have a lot of videos of people who have all kinds of different stories to tell. And there's some photos. This young man, tell us about this young man right here.
That's Chris, the one that the testimonial.
That's the testimonial right there?
Testimonial.
Oh my gosh,
that's Chris.
there he is.
Yeah. Chris is fairly young. Usually when I see patients, they're older, but Chris is fairly young and he just had a lot of trouble with his teeth. He came to us for a consultation. Again, we went through different options with him and figured out a way he could afford to do this. And then we took impressions, got some dentures ready for him, and went forward with the surgery. And that testimonial he sent the next day. I expected him to be a little sore or something. No, he said he was in no pain at all.
Yeah. Well, we should talk about the pain for a second before we get into the next photo, because when we say it's less pain, it's really an issue where an over-the-counter medication can help mitigate whatever slight pain there is.
Most of the time, yeah.
Yeah, like an Advil or an ibuprofen.
Most of the time.
Yeah. Now, this next young lady, tell us about her.
She was a young lady that was missing her lateral incisors, the two incisors on the side of her central incisors. And she'd always had to wear retainers growing up because as an adolescent is developing, you don't want to put anything in the bone because they're still expanding, they're still growing. But she was 18 or 19 at the time I met her, and when somebody's missing their teeth that long, the bone tends to be very thin. And generally, if the bone is too thin, you have to go through some grafting procedures to, it's expensive and it's time consuming before we can get dental implants in. Well, I looked at her very quickly and I knew I could get some mini dental implants in her lateral incisors. So in one day, we placed those 2 mini dental implants, put temporary crowns on her in the same day, and within a few weeks, she had her permanent crowns.
Very, very short amount of time.
Yeah.
And this is all happening in your office in all of the locations that you have.
Yes.
Yeah, so it's an in-office procedure. You don't have to go anywhere else. Let's take a look now at some of the videos of Dr. Lasorsa that we have online from our YouTube sensation, Dr. Matt Lasorsa.
I think you brought back my life. And I'm very happy.
First thing she said, your teeth are beautiful.
The lower denture was very loose. It gave me a lot of problems when I tried to chew any food, and food would collect underneath the denture. So thought I needed to do something, and this was a great answer to the problem. It really was.
I'm so happy I could eat right, and I had corn on the cob for the first time in 20 years. What a thrill. I'm very happy with it. Everybody thinks that my face has changed completely.
I will never go back to denture. This has been the best decision I could have made.
I think it's great. Before, I had to use Potter Grip and all that, and that is stay in. I couldn't eat with them, but now I can eat anything and everything I want to eat. They do not move, they do not fall out or nothing. And this man is great.
And that's what I like to hear, not about the great part, but just about that he's happy and he's using his dentures and he can eat anything he wants, because that's the whole point.
I'm really, really pleased with everything. And they're in and they're mine and It's worth every penny, the comfort, even how it looks, everything about it.
And I'm looking forward to eating and smiling again.
I'm really liking it.
I'm sorry I waited so long.
Me siento súper feliz porque me han devuelto la sonrisa y eso no tiene precio. De verdad que muchas gracias.
De nada.
So Dr. Lasorsa, those were incredible testimonials that we just saw, but there's one specific story that really stands out. And when we talked earlier about age and somebody putting this off or saying, I'm too old, you're never too old. Tell us about the vet that came in, because it's a very special story.
This was a very special situation. This was a patient that is a World War II veteran, and he lost all his teeth when he was very young. Could not wear dentures. Tried several times. Could not wear dentures that anybody made for him. And now he came to seek me out to get some implants to try to wear dentures again. He was 92 when he found me. So we put some implants in his upper and lower and secured some new dentures on him. And you'll see in the video how well he's adapted to them right away. 70 years without teeth.
Wow, amazing.
70 years without teeth or dentures.
Well, let's take a look at what Dr. Lasorsa did for this American hero.
And you lost your teeth in World War II, right?
World War II, I pulled them out while I was in the foxhole. They hurt me and there was no dentist over there, so I've had to pull them out.
So this is what I was getting to. He hasn't had teeth for 70 years.
He wasn't wearing dentures. He didn't have any teeth. So for 70 years, he went with no teeth, no dentures. And here he is. I had to go through a lot of hoops to get these implants in him. I used a big combination of implants to get implants on the lower, implants on the upper. There was no way he was going to wear a denture without implants holding him down. So here he is with his new dentures, 70 years later. So let's see the smile now. There you go. That's what I wanted to see before.
Smile.
So Robert's going to go out and order some French fries now, because that's his favorite. And we're going to hear how he did after this weekend. So you're going to wear these all weekend and order as many fries as you want, right? All right. Very good.
Yeah.
It was a lot. But I'm glad with the end result, and thank you for your service.
So Dr. Lasorsa, seeing that is an inspiration. I mean, this is a generation that is unfortunately leaving us day by day, and you've given Robert a brand new lease on life for the time that he has left. It's an incredible story.
Yeah, it's a great story on Robert.
And I would imagine there's a lot of vets that you help because you were at the VA, as you mentioned, and that must be very special to you to help someone like that.
I do want to help the vets. The Veterans Administration is now actually allowing, in certain circumstances, for them to seek dental care in a private practice setting. So I've treated several veterans in our private practice that the Veterans Administration will pay for now. So I've done several dental implants on veterans that were paid for through the VA.
And that's terrific. As we said, they're going to have a whole new lease on life. And I bet Robert is out there now enjoying all the great food. I think he likes French fries, he said.
Yeah,
so
that's
there
his
you go.
favorite.
You also, we don't want to get too inside baseball with this, but you actually have come up with an opportunity to make the mini dental implant procedure even better with a new kind of material to actually replace some of the zirconia that's used in the implants that we taken a look at.
I mean, zirconia has been the material that's traditionally been used for maybe the last 10 years or so to restore dental implants or even natural teeth. In my opinion, zirconia is very good for a single tooth or maybe for a bridge like we saw in the models. But when you do a whole arch, zirconia is very slick, it's antibacterial. But when you do a whole arch, it's very heavy and it's very rigid. Now the jaws expand and contract when we chew and smile and talk. The zirconia does not. So if you ever have an issue with the zirconia, it can chip, it can break, and it's not repairable. You can't bond to it. You either have to trim it down or start all over again, which is very difficult for the dentist and the patient. The newer materials out there, it's a repairable, bondable material. So it looks just as good, but it's a lot lighter, a little more flexible, and it's repairable even if it's a fixed restoration that you can't remove out of the mouth. It's repairable in the mouth.
That's amazing that you helped create this revolutionary procedure.
I don't know if I should say I helped create it.
Well, you certainly were a part of it.
It was used, there was one implant company that had the patent on it for several years. Once the patent expired, now there's a lot of competitors making similar products, and now we're going to see it become a lot more mainstream in the next few years.
And this is a part of your practice at Central Florida Dentist Group, 352-269-8009, the website centralfldentist.com. If you've been watching us for the half hour, now this is really going to make sense. If you joined us halfway through, talking about the mini dental implant, and if you've got dentures and they're swimming around on the bottom of your gum, imagine how this is going to change your life. Show us why, Doc.
Okay. This is a mini implant retained lower denture. I tend to put 4 to 6 mini implants on the lower jaw, have these attachments processed into the denture, so it will lock right onto your implants and hold your denture still, and no more goo and no more loose teeth.
And the confidence is back, and
Absolutely.
you feel so much better. So imagine you're taking the dentures out at the restaurant or with your family function. It doesn't have to happen anymore. We'll take a look now at the upper denture because this is interesting with the sense of taste that now comes back.
Upper denture is very similar. The bone is a little softer on the upper, so we use a few more implants. I tend to put 6 to 8 on the upper, but it still works the same way. There's these attachments processed into the denture, and that will give it its snap. And what John was talking about is that once we have the denture secured in place, we no longer need this palate. A typical denture will have plastic all the way across the roof of their mouth because they need suction there. Well, with the implants stabilizing the denture, we don't need that suction. They're being held in by the implants and the attachments, so we can horseshoe this out and give you your sense of taste back.
So the hot, the cold, we love all of as I said, the great fresh fruits and vegetables that are grown here in Florida, and the fish that you catch and cook for us. We will now get that sense of taste back. This is going to be another example, and Explain the fixed on 6.
This is the fixed on 6, which is not fixed, it's just a catchy name. However, it does feel fixed because it's very tight. I tend to put a few more implants on this, minimum of 6, but I tend to go 8 to 10. So it fits very secure, and this is where we use that newer material that you were talking about. That's very aesthetic, very light, very strong, but you'll notice we can make it very thin because the more implants we have and the stronger the material we can use, the less material we need around the implants.
So this is what's called the fixed on 6, but there's an even greater way that the mini dental implant can change your life, in the sense that if God gave us our first set and our second set of teeth, you're going to give us our third set of teeth. This is the ultimate experience.
Yeah, the most permanent restoration we can give you is the roundhouse. This is something that's cemented on, okay? It does not come off. We have to have a lot of support from the implants. But again, we'll use a different material so we can make it very thin, and this would get cemented in place, and this is fixed. That's as close as we can get to your natural teeth.
And it looks terrific, and the plastic from the, obviously from the dentures is not there. But if you have a single tooth, if you have an accident, you have a medical issue, and you want to get it fixed in the office with an American-made product, show us how a single tooth can be helped with the mini dental implant.
Single tooth is very simple. We're missing a tooth, we place an implant in the bone where the tooth was missing, and then we cement the crown on, and that's your new implant supported crown.
And it looks terrific because it's a custom-made tooth just for you, the patient, just for you. Really.
Absolutely.
And you know, those teeth in the back, as we talked about, some people think they're out of sight, out of mind. I know some of you are watching going, why do I need to care? You need to care because you're going to taste your food better and you're going to be able to chew. Show us that.
If you're missing several teeth, we can put a few implants together, lined up together, and then we make a fused bridge or a couple of fused crowns together, and that gets cemented on, and that will replace your missing back teeth as well.
And there it is. It's the mini dental implant. Dr. Lasorsa, we've learned so much in this time together, and I want you to write down this number, folks. It's 352-269-8009. The website, centralfldentist.com. Dr. Matt Lasorsa from Central Florida Dentist Group. What motivated you ultimately to be a dentist, Dr. Lasorsa?
Well, I always liked biology and medicine and science, so I was always interested in that subject. However, I had a lot of injuries as a child. I was always in the hospital, so I did not want to be in a hospital setting. And I liked working with my hands, and I always liked going to the dentist. I never feared it. I liked my dentist. I liked it because he let me go in the prize box after. But I still keep in touch with him. He's a very nice man, and I just decided that that was a way I could keep working with my hands, pursue science and biology, and not be at the hospital all hours of the night, and work with people.
And you do. And if you're out there and you haven't been to the dentist in a long time, no matter what your issue, if it's a mini dental implant or something cosmetic or something that you need done, go to see Dr. Lasorsa and his team at the Central Florida Dentist Group. You meet his wife, you meet your team, and you are an innovator in health in so many ways here in Florida. We're lucky to have you here in the great Sunshine State. Thanks for joining us on Innovations in Health.
Well, thank you, John.
Thank you, and thanks for watching, everybody.